Okay, so here are the questions that are very important and asked in multiple exams, like different exams. In the part of sperm containing proteolytic enzyme, which part containing proteolytic enzyme that digests zona pellucida of the egg, that is acrosome. This is why it is called acrosomal reaction. When the head of sperm is releasing the proteolytic enzyme, in which part of the brain neural activity increase before skilled movement, that is cortical association area. It is a physiological area in which there is increase in the activity while movement. Next one is which hormone responsible for increased gastric emptying, that is gastrin is responsible for increased gastric emptying. Gastrin is responsible. Niacin deficiency causes which of the following, which is central nervous system defects. If there is niacin deficiency, CNS defect is there, and also pellagra can be caused by deficiency of certain thing. I am okay. So pellagra is the deficiency of niacin and vitamin B3 level, in which there is dementia, diarrhea, dermatitis. As you can see, skin is involved. There will be dementia, CNS impact will be there, and dermatitis. So severe dermatitis can occur because of niacin deficiency, and it is known as pellagra necklace, as you can see here in the pellagra necklace disease because of vitamin B. Okay, so next one is transient adhesion of WBC to the endothelium occurs because of selectin. And then the hip surgery vessel of the head of the femur ligated which artery remain the source of the vessel, that is femoral artery is the source. Next one is okay. Next question is a patient is having traveler's diarrhea, not responding to antidiarrheal drugs. Which should be given? Which medicine should be given? Medicine is norfloxacin is given to the traveler's diarrhea. Niacin deficiency, CNS defect. Hormone responsible for emptying gastrin. Okay, so next one is a patient present with Crohn's disease. His treatment remission corticosteroids are given. Based maintenance of the remission is azathioprine. Corticosteroids plus azathioprine is the base treatment of the choice. Next one is a lady present with a trauma examination, loss of dorsal sensation of the left foot and loss of eversion talocalcaneus joint. The answer is common peroneal nerve is the eversion defect. Now we will be looking at the depth at a common peroneal nerve helps in eversion of the foot and also known as fibular nerve. It is major nerve of the leg. Gives it is branch comes from sciatic nerve, and it helps in the eversion of the foot. So common peroneal nerve. Common peroneal nerve entrapment occurs, and then, as I mentioned earlier, that patient has certain, like, there is the trauma and patient has loss of dorsal sensation of the left foot and dorsiflexion, loss of eversion at talotarsal joint. Which nerve is involved? That is common peroneal nerve. So lamella forming minimum air blood barrier, that is pores of Kuhn. And next one is a person running a marathon race, blood flow to the non-exercising muscle is sympathetic cholinergic. Next one is a woman with 5 weeks of the pregnancy. German measles is there, and she is consultation of the obstetric. Baby worrying will be there. Complication might be to the baby will be congenital cataract because of the measles is caused by rubella in the pregnancy. Congenital cataract and deafness can happen in the pregnancy within 5 6 week. Heart defects is there. Rubella in the pregnancy complication with 7 months is cataract. So in this way we can look at this. Next one is G protein phospholipase C increase the calcium level. Increase in the potassium level can cause which of the following is the causes can cause flaccidity. Potassium can cause flaccidity, increase in the potassium level. Next one is adult polycystic kidney disease is autosomal dominant. It is why they call ADPKD autosomal dominant polycystic kidney disease. Next one is side effect of dicumarol is delayed clotting. Dicumarol is a drug which has side effect of delayed clotting. Massive blood transfusion leads to hypokalemia. Hypocalcemia. Massive blood transfusion leads to hypocalcemia. Patient with ETT heat loss will be because of evaporation. Next one is vein accompanying left anterior descending artery is great cardiac vein. Now let us look at the venous drainage of the heart. So here we can see great cardiac veins runs anteriorly in the interventricular groove alongside anterior interventricular artery, and there is also left anterior descending artery. So the question we will come, vein accompanying left anterior descending artery is great cardiac vein. Great cardiac vein is associated with the left anterior descending artery. Great cardiac vein with some part of the between left and right ventricular anterior great cardiac vein. Drug distribution through aqueous diffusion is digoxin. Apex of heart is supplied with anterior interventricular artery or left anterior descending artery. Primary villus consists of cytotrophoblast plus syncytiotropoblast. What does PR interval shows? PR interval ensures SA node conduction to the ventricle and atria contracts in this period. Atrial stage lead to tachycardia because of brain bridge reflex. When atria is strayed, it leads to tachycardia. S1 and S2 heart sound. If comparing S1 and S2 heart sound, farmer has more duration. Now here we can see S1 heart sound has more duration and a dullness than S2. S2 heart sound has more frequency and pitch. The cause of atherosclerosis, usually endothelial injury, can lead to atherosclerosis. It is known as Virchow-triad endothelial injury, stasis, hypercoagulability. And the next one is, which factor should be more important in descriptive study? That is sexual factor. Antidote for opium is naloxone. Intrinsic pathways activated is 11. Treatment of severe thalassemia is B. Regular blood transfusion with schedule is the treatment of the choice. Solinger-Ellison syndrome is uh, gastrin secreting neoplasia, increased peptic ulcer is there, polysynaptic is related with cremasteric reflex is polysynaptic. A patient is diagnosed with atrial fibrillation. How will we manage the patient? We will manage with cardioversion. Okay, next one is, what does bacteria secrete with the help of proliferation of the new capillaries, that is platelet derived growth factor? A patient has complex partial seizure. How will you treat it? With complex partial seizure, treated with carbamazepine with primidone. Next one is, a patient develops sudden weakness of the right upper limb and lower limb and mouth deviation. I think mouth deviated to the left side. Artery involved in this is the middle cerebral artery. Tumor suppressor gene is P53. Next one is a hormone that increased bicarbonate secretion from pancreas is secretin. Okay, so thigh adducted, medially rotated, and flexed with the help of sartorius muscle.